While we may not have all the answers about how this variant will change the fight against coronavirus, one thing is clear: much of the developing world is lacking access to our biggest weapon, and the numbers are stark. Of the 8.1 billion vaccine doses administered globally, there have been 150 doses per 100 people in richer countries. This, of course, taking into account that second and even third doses are being used to reach immunity. The number on the other end of the spectrum, 8, just 8 per 100 people. Well, my next guest is Lynda Caprani. She's the head of Advocacy for Global Vaccines at UNICEF. As the news, of course, of the Omicron variant broke, she had this to say. She said, warning after warning after warning. This won't end for any of us until we end it for everybody. You can't end a global pandemic one country at a time. Well, Lynda Caprani joins me now live from New York. Good to have you with us, Lily.
Good morning.
So UNICEF is, of course, the biggest single distributor of vaccines in the world. You are the experts. You're leading the way to procure and to supply COVID-19 vaccines. And this is a huge undertaking, right? To end this pandemic, mass vaccinations have to happen as quickly as possible.
You're right, it's completely unprecedented. Even before the pandemic, UNICEF, with the UN Children's Fund, so we vaccinate nearly half the world's children. So we know what it takes. It's a huge logistical challenge and a challenge with reaching remote communities all over the world, engaging them and helping them understand how vaccines work and how they can protect them. Now we're trying to do that for the COVID vaccination program as well, but we've got all these additional challenges, which is that even though the world has got billions of vaccines now, they're just very unevenly distributed around the world. And although we can deliver them when we've got them and get them to communities, there is such an unequal sharing of these vaccine supplies between countries. We're still seeing countries where vast swathes of the population are completely unprotected, including healthcare workers. You know, in Africa, sometimes we see less than 1 in 4 healthcare workers have even been offered their first dose. It leaves a very dangerous situation.
Yeah, it really is stark, those figures. And part of the issue, no doubt, is the fact that countries are treating this like a national issue, closing borders and hoarding vaccines. And almost 2 years into the pandemic, millions of vaccines are set to expire in wealthy countries in the coming weeks. And just for our viewers, I just want to bring up some more data we've got, which shows that 54.8% of the world's population has received at least one dose of COVID-19, but only 6.2% of people in low-income countries have received one dose. Explain for us, Lily, the difficulties of getting vaccines to remote areas. What sort of support does UNICEF need to make that happen?
Yeah, I mean, if all of us living in high-income countries that have got quite good vaccination rates cast our minds back a few months, we'll remember that being able to stand up a huge mass vaccination campaign is a massive logistical challenge, even in countries with really strong healthcare systems, lots of healthcare workers available, you know, and all the infrastructure and the money that was available. It's still a big challenge. So if you now translate that into a lower income context where countries already have quite weak, fragile healthcare systems, you can imagine the challenge that they face. And UNICEF is working with all of these governments in the lower income countries to try to get them ready for when vaccine supplies finally arrive. You have to do things like install refrigeration to make sure that you're keeping all of those stocks of vaccine doses fresh and ready for use. You need to make sure you've got lots of trained healthcare workers ready to go and vaccinate. We need to make sure they're getting paid regularly. Unfortunately, there's not enough money sometimes to keep paying vaccinators. And the trouble this year is that because the supplies haven't been getting to those low-income countries, it's not as if they could have all of these things just sort of on standby. You can't recruit an army of vaccinators and then just have them sitting around. So now that we're finally starting to see vaccine supplies arriving, they've got this race to get ready to do the big vaccination campaign. UNICEF is helping. We're trying to get as many of those doses into arms as soon as possible. And that means working round the clock with those governments to get ready. But there's not enough money sometimes, and there's a lot of technical challenges that we need help with.
Yes, so many technical challenges. I want to ask you a little bit about that in a second, but I just want to show some vision that we've got from UNICEF showing shipments of vaccines arriving just in the last few days, arriving in places like Laos, donated by Finland and Sweden and the Netherlands. Another shipment arrived in Kyrgyzstan, which was donated by France. And another batch of doses landed in Bangladesh. And just last week, the Pacific Islands got some much needed doses. Talk to us about how things are starting to ramp up and how crucial it is for countries like Indonesia, places around the world trying to scale up its ultra cold chain capacity in order to store these vaccines, which need to be stored in frigid temperatures.
Mm. Yeah, well, as you said, now finally, after a year nearly of having virtually no supplies available to COVAX, which was supplying these low-income countries that UNICEF has been delivering for, we are getting doses coming through, and mostly they've been coming because high-income countries that have got plenty of supplies themselves are starting to donate them, which is good news, and the US has been one of the biggest donors as well. One of the challenges we've got is if we don't know exactly when those supplies are coming through, it's quite hard to do any kind of planning to get ready to actually deliver them to remote areas. We need to know exactly when we're going to get the doses, where they're coming from, how long of a shelf life they've got, because if they're doses that are going to expire soon, then it gives you very little time to plan. And as you said, whether they need certain types of storage. So the different products available need different kinds of storage. Some of the mRNA vaccines, like Pfizer and Moderna, require a different kind of storage, and different supplies are available to us. So it's a complex operation, and every time a government very generously pledges to give us some spare supplies, we really need them to take into consideration all of the planning that goes into getting those doses into arms. So that means giving us doses with a good long shelf life, making sure they come with all of the things you need, the infrastructure, the syringes, the diluent, all of the other costs that go into the freight that takes those vaccines out to countries. So we're asking really for this kind of support to carry on, be more predictable, more reliable, to allow us to plan, and to help UNICEF do what it does best and reach every single last community. We need as much notice as possible about when we're going to get those doses.
Exactly, that communication also very key. Lynda Caprani from UNICEF, we appreciate your time and all the work you are doing. Thanks so much. Well, you can get the latest developments on the new variant and other coronavirus stories. Just go to our website. You can find it at cnn.com. News, analysis, including why 2 South African researchers say their country should not be punished for alerting the world to the Omicron variant. They argue that quick decisions to impose travel bans don't work.